Is LDL cholesterol as meaningfully associated with increased mortality or cardiac-related mortality as once thought? In other words, when a patient has elevated LDL or non-HDL cholesterol readings for a period of time, is that really as strong of an indicator of mortality as once thought, or are there other very significant factors at play that require just as much attention, if not more? Of course, there's no question significantly elevated LDL over time, even familial hypercholesterolemia, is an indicator of many things and is associated with an increased risk of mortality over time. But what if you were presented a plethora of data showing decreased mortality risk associated with hypercholesterolemia? In that case, are there other significant risk factors we need to pay closer attention to? Well, there's yet again another study out suggesting just that. Stick around because this data is very interesting. Hi, I'm James. I'm a registered nurse and health researcher with PrevMed, and we bring to healthcare workers like doctors, physicians, assistants, nurse practitioners, and registered nurses health information and trending medical news that matters. To recap, to a degree, there's no doubt there's an association between LDL and non-HDL cholesterol and increased mortality. But when you see data frequently indicating the opposite, that means we need to keep an open mind. Interestingly, there's a new study out by Rosansky et al. Indicating a 28% reduced risk of all-cause mortality in those with hypercholesterolemia. If you look at this forest plot, there's a rectangular area that's red. If you look on the bottom right, the hazard ratio for all-cause mortality with risk factor hypercholesterolemia reveals a 28% reduced risk of all-cause mortality. Even more, when you look at this next image, you see LDL compared to non-HDL values. Well, as you can see by the red lines in each, those with the highest LDL or non-HDL over 130 and 160 respectively have higher all-cause mortality survival than those with low HDL or non-HDL readings over 9 years. So what does this mean? Well, when you look at this, many people in this study had two important similarities: diabetes and somewhat advanced age, whether they did or didn't have elevated LDL or non-HDL levels. Those are two substantial risk factors that will surely increase risk of mortality, certainly when LDL or non-HDL don't seem to be meaningfully increasing that risk. Increased sugar and aging have more drastic effects on health than most people realize. That's because high blood glucose, diabetes, pre-diabetes are underdiagnosed, and they're the driving factors behind much of the heart disease, kidney disease, eye problems, arterial plaque, heart attacks, and strokes we see these days. Don't forget, insulin resistance is one of the biggest risk factors for inflammation, and inflammation is the root cause of nearly every disease. And by the age of 60, nearly half of us have insulin resistance or blood sugar problems. So what's the verdict on LDL and non-HDL when they don't seem to be influencing all-cause mortality like this study shows? Well, it could certainly be argued we may also need to take a closer look at our blood sugars and insulin resistance.